We're gonna try to give this a second go. It looks like the Raptor Center folks are coming back. So once they give me a thumbs up, I'll add them and we'll give it a second shot.
And thanks for everybody's patience.
Yep, technology is super fun.
All right, we got a thumbs up from the Raptor Center folks. All right, well, welcome back. And how about you take another opportunity to introduce yourselves and then tell us about the status of our good Falcon Knox.
Sure. I'm Michelle Hawkins. I'm a professor here at School of Veterinary Medicine at UC Davis and also the director of the California Raptor Center. And I've been working with the Raptor Center now for 25 years.
My name is Julie Cotton. I'm one of the supervisors at the California Raptor Center. I've been here since 2011 and in the supervisory capacity since 2021.
And my name is William Thine. I started volunteering back in 1996, and I've been working here for 2 years as another operations supervisor.
Well, thanks so much for joining us. Sorry for the technical problems earlier. I really thought we had it tested and everything working, but
yeah, we did. We really tried to get it done on the front end.
Yeah.
Well,
how is
Knox?
How is Knox?
Yep. That everybody
wants
to know, right?
So let's do some background too, because it has been asked of us, how did he get injured in the first place?
Yeah. And we don't know for sure. We know Knox was injured a couple of weeks ago, and he ended up in the UC Berkeley or the Berkeley Marina. So most likely he probably hit some like rigging on a sailboat or something and injured his wing. And we'll go probably into a lot more detail on what the injury was. But he was recovered by some wonderful volunteer organizations that took care of him. And then he was eventually transported to the California Raptor Center. So that's where he is now, where he underwent surgery. And we're going to get our update on what he's up to now.
Sure. And I would love to give a shout out to Bay Raptor Rescue, to Craig Nikitas and to Valerie for going and getting him, scooping him out of the marina and taking him to Wild Care San Rafael, whose veterinarian was out of town. And so they called us and asked us if we could take him. And so, yeah, he had surgery a little over 2 weeks ago now. I can tell you he had surgery on the very what we call distal, the very distant part of his wing. It's the leading kind of edge of his wing. And there's two bones here that would be just past the wrist where our fingers are. And both of those bones were fractured. And unfortunately, they were in more than 2 pieces. So an excellent fracture at that site would be where you just have one break in the bone. Unfortunately, the bone was in some pieces. And so I'll just use the analogy of Humpty Dumpty. And my colleagues, Dr. Bufreer, Dr. Ariella Darvish did the surgery. And they ended up putting Humpty Dumpty back together again, basically. They had to use quite a few pins in order to be able to bring the pieces together. And then they fit a bar that is super lightweight. It won't hold down his wing or make him drag his wing at all. And that is the beauty and why we've been successful recently, or more recently in the last 10 years, I would say, with repairing these fractures. And so when we heard what the fracture was, we said, of course, we want to give it a try. Even if it weren't Knox, I think that, we would have given this a try. But with the x-rays yesterday, we do x-rays about every 2 weeks because you have to give it some time in order to heal. And we have to be able to see that on the x-rays. And the x-rays yesterday say that it is healing, but it is healing slowly. And so what I would love to have said would be a 4 to 6 week healing of the bones. And that's only phase 1, right? It's just getting out of the veterinarian's care and getting into the true rehabilitative care. Now, I'm afraid, is probably going to be 8 to 10 weeks. And that is if everything goes very well. And unfortunately, we know that every day we come in and we're all holding our breath that everything's still going well and nothing has happened that could put him back. And the good news is that he's a real champ. He at first was like, wait, where am I? What am I doing? But he is eating really well, and we're putting all of our medications in his food so that he doesn't have to be handled any more than he absolutely has to be. We have a little bandage around just the tip of the Fixator, is what we call the bar that's holding the pins together, to keep him from being able to potentially catch it on anything, even though I can tell you that Julie looks at every nook and corner and makes darn sure that there is nothing that he could get that bar caught up on. And so that is where we are this morning. Do you guys want to add anything?
Just yeah, he's looking really good. His first week or so here, he didn't eat great, and that's not uncommon for a bird that's just come in from the wild with some sort of traumatic injury. But he has been eating really well since then, gotten back up to a really good body weight, and right now we're just kind of in that holding pattern of waiting for him to progress with his bone healing.
Got anything you want to add?
All right. So question we have from the audience then is, so if he's not been able to fly for some time as he's recovering, how do you help them regain the strength for flying when they are ready to be released?
Go for it.
Yeah, so that's a great question, and it's true for all of our raptor patients, and especially true for the falcons, that they need to get back into what we would consider athletic conditions. So just like when a human enters hospital, a lot of times you'll be bedbound, you'll lose muscle mass, you'll lose strength, so you have to recondition yourself. And what we do for most species that we receive here, species like some of the owls, red-tailed hawks, we put them in a large aviary and allow them to fly. And that's the end part of the process. Usually their stay here begins in a small hospital cage to restrict movement as they heal. Then they graduate to a mid-sized enclosure to start building up muscle, then to a flight cage. But with a falcon, it's a very different story. Flight cages these aviaries are not safe for falcons. The amount of speed and strength that a peregrine can build up could lead to them colliding with the wall of the aviary and becoming injured. So we typically work with falconers to take a falcon who has moved past the hospital cage stage, has maybe been in a small 8-foot by 10-foot aviary for a little while, building up strength. And then we send it with a falconer who can do that final conditioning and assessment, because the hunting style of the falcons involves free flight, getting high up into the air, hunting avian prey, and you cannot mimic that very well in an aviary. So we have contacts in the falconry community who've helped us out a lot in the past with other falcon patients, and we expect that is the route that Knox will follow if things progress well with his injury.
And kind of a follow-up to that, how long does that process take to kind of get that strength and skill back?
Yeah, if you think about if you've ever had a fracture yourself, okay? So even when you were a kid, if you had a fracture, maybe you were in a cast, maybe you did have a Fixator like Knox has, but you are immobilized for a certain amount of time. The rule of thumb in humans applies to these birds, and probably even more so to the birds to some degree. But again, think about it as if you were an athlete. So for the amount of time that you're immobilized and you are not utilizing that limb, it takes 2 times that amount of time usually to condition back to where you were before the fracture happened. So if we're talking about potentially 8 to 10 weeks in this recovery, he may go faster with a falconer than what he would do conditioning in a chamber on his own, like a red-tailed hawk or a great horned owl would. But nonetheless, it is the next phase after the recovery period goes into the restorative or the conditioning period. And that period is at least twice as long as the recovery period was.
And I should add on as well, if Knox goes out with a falconer for conditioning, it's not just building up his strength, it's also developing his hunting skills.
That's
because
right.
right now he's a juvenile and he's missing out on a period of his life where he would still be getting experience and developing in the wild around the parental territory. So he will be learning to hunt while he's out as well. And that is a more indeterminate amount of time that would be up to the person who's working with him to be making that assessment of how well he is able to hunt.
And I just wanted to add on to that thought, and a lot of people don't know this, but being a young bird or young raptor is a very hard time out in the wild. The average mortality rate is about 50% in the first year of life for a wild bird. So what they just talked about is really important for that survival, is being able to get those skills and being able to do it supervised. Normally they'd be supervised by their parents, but when he's not in that situation, being supervised by a falconer really will up that survival rate a lot higher.
Yeah, but this kind of goes in well to the next question. How are there issues regarding Knox becoming overly accustomed to humans, especially in relation to working with a falconer?
So honestly, he's at the stage of his life, he knows he's a falcon. Yeah. So he's past what we would worry about as the window of imprinting on a human caregiver. With baby raptors that are brought to our facility, that concern is usually limited to when they're still in the nest. And beyond a certain point, they have imprinted on their own species. And Knox knows he's a falcon. So the concern would then be habituation to humans. Imprinting is a more irreversible process. It's kind of a permanent, almost rewiring of their brain and their recognition system and their social relations, whereas habituation is a learned association. They're learning that humans are associated with food. With him, we don't have a lot of concern about that. He's a very wild acting falcon. The falcons in general have a reputation in a rehabilitation setting for being relatively high strung, reactive to humans, and Knox very much fits into that mold. The way falconers work with their birds, they do have a working relationship in that they work to help flush prey, take the bird to locations where it will find prey, so they help the bird be successful. But it's kind of a teamwork relationship, and the bird at the end, when it's ready for release, will not ideally, most likely be returning to humans for food. So it's not really a concern that Knox is going to become overly attached to caregivers or falconers.
But while he is with us, we're going to do everything possible to make sure that he doesn't get that habituation. Mm-hmm. And so in our clinic, in our hospital area, I should say, whispers at the most. When we're around him, we're not talking now. He's talking to us, let me tell you. If we have to get him in hand, he is definitely talking to us. But we, try to minimize having to touch him, having to have humans interact with him every day. That's why all of his medications now, thankfully, he's eating so well, can go into his food. We don't have to catch him to give him his pain medications. We gave him antibiotics in the beginning because he's got pins through his skin going down into his bones. Those medications start to add up, and you have to give them twice a day usually. And so that is a lot of handling, and we don't want to do that because it's very, very stressful on the bird. So all of our techniques that we have, that we use every day with birds, we're taking up as high of a notch as we possibly can with Knox.
So what we have is relating to kind of a customization to people. People are also quite a few questions about how is this going to, to an extent, is he going to return to his natal territory when he's ready to be released? Is he going to gravitate back to where he was from? Is he actually going to encounter his parents ever again at this point?
We can't respond to that final question. He's out of the nest, and out of the nest with peregrines, bye-bye, next year. So I can't tell you about Archie and Annie, although that's their territory as well. His territory is Berkeley, and we have every intention that he will go back into the territory that he was born in. That is expected of us as rehabilitators, to reunite these birds in their own territories. And for example, sometimes we'll get birds, for example, eagles that come from up near Lake Shasta, hours and hours north of us. And if they're brought to us for rehabilitation care, we take them back to their territories, even though it's a long way away. And we even do that in the local areas with birds that are brought in from 20 or 30 miles away. We find out exactly where they were found, and we take them back and release them in those areas if it is safe. And that is going to be the key thing, because we're going to be in a very urban area with him. And we're going to have to think about where we can release him, that as he takes off, and he will take off from us, that he's going to be safe in those initial flights till he gets his bearings again. And then he can decide if the Berkeley Marina is going to be kind of one of his territorial areas.
So, and there's a little nuance to it as well, which is it'll depend on when he's ready for release. So if he happens to be ready for release before his siblings have completely dispersed from the natal territory, then it would probably be safe for us to release him nearby. And there is the possibility of reunion with the parents if he's ready by that time. However, if it's at the point in the annual cycle where the other siblings have already dispersed and left the natal territory, then we wouldn't want to necessarily risk releasing them right by where Annie and Archie are, lest that trigger a little bit of aggressive interaction.
Sure.
So ultimately, it's going to depend on when he's ready for release, what the state, the wildlife agencies for the state determine as a release location for him, and what his condition is, because he will still need a lot of assessment after he has graduated from our care and from the rehabilitation part of the process with the mending of the bones. The falconer or whoever he works with is going to have to assess how well he's flying in a big open space, because he might look great to us in a small chamber, but when he's out there, when he's flying hundreds of feet in the air, thousands of feet, hunting other birds, that's going to be the real test of the function of that wing. So there are going to be a lot of dynamic factors that play together to determine release timing and release location, and it's just too early for us to really say anything determinatively yet.
But one way or another, we believe that he will be back into that area. Yeah. We wouldn't be just, releasing him outside of the California Raptor Center.
Yeah. And one thing that we can add to this story is that we're getting very, very close to the time where his siblings will be off on their own. We're actually a little surprised they're still sticking around. In previous years, they've been gone by mid-July-ish, but we've seen at least 2 of the 3 in the last couple of days. So they're still sticking around pretty late in the season, but we expect them to be gone any time now.
All right. And I have a question of my own. Say you had a migratory species come in during migration season, so you don't know where the bird's territory is. Where are you likely to select as a release site? For example, if it's a peregrine.
Well, I think we could give a wonderful, example that's happening right here and now for us that happens every year with the Swainson's hawks in California. The Swainson's hawks will come to Yolo County, which is where California Raptor Center is, and we see them amazingly here and into Northern California to breed, nest, and then after they've nested, they and the chicks will migrate together back down to Argentina and Peru. And so it is vital for us, if we have Swainson's hawks chicks, that we have them conditioned and ready to be released in time that they can find a kettle, because they've never made the migration before. And while I can't think for that bird and know what presets it gets in its brain when it's a chick, we do know that they go in large groups called kettles, and the first year birds are following the adult birds to learn the migration pattern. And so that's one example that is happening in the here and now. We have how many? 8, 9?
We have about 6 young Swainson's hawks that are conditioning in a flight aviary right now.
And we will need to get them out of here at the latest by mid-August. Or else we're going to be really worried. And if if we weren't able to get them out of here, say a bird comes in the second week of August, that would mean we need to keep it until next year before we release it.
And for migratory birds that come in, if we get an injured migratory bird during migration season and we're able to rehabilitate it and release it during migration, often we'll take it to near where it was originally found to just let it resume the journey. But if it is one that has missed the migration period, we had a Swainson's hawk juvenile last year that broke its leg when it fell from its nest, had to have, much like Knox has an external fixator on right now, that baby Swainson's hawk had an external fixator on its leg. He missed migration. We held him over the winter and released him when the Swainson's hawks came back to the area in the springtime. So yeah, it's all timing dependent, location
species
dependent.
All right, so here's a vet question for you. Do you use the same type of pins that human orthopedic surgeons use, or are avian ones extra lightweight?
Yeah, so this is a really great question, because it's so exciting to me as an avian veterinarian and surgeon to be able now to access some of the things that we used to not be able to access. When I was a resident and coming up, what we had were basically the pins, the same things that are used in humans. However, in this 25 years of time, in humans now, they have little teeny pins that they can put, your pinky back together again with. And, your pinky, the bones in your pinky are very similar in size to the bones that are in his wrist there that are fractured. And so the pins that we use are ultra lightweight. They are made for human pinkies. And we gauge and use the size that we need for the bone itself. So a larger bone, we're going to have to use a larger pin. But the bar itself that's on the outside is incredibly lightweight. They're made of titanium. It's a pretty expensive kit that we buy from France, but it's been worth every penny we paid for it, because it allowed us to do surgery on a lot smaller birds, without having something bulky on them that was going to prevent them from trying to be as normal as possible during the recovery period.
All right, and I'm having a thought here. You had kindly provided a lot of these slides, and a lot of them we probably could really use some context for. And so would you care to go through some of these slides and tell us about what we're seeing in the slides? And I believe you should be able to, on your end, where the slides are in the lower section, go back and forth through the slides with the arrows if you'd like to do it yourself. Otherwise, I can advance the slides for you as well.
I think you'll have to advance them. We're not seeing that opportunity. The one that you're seeing right now is my lovely colleague's back of his head. I'm sure he's loving that. But this is Dr. Hugues Bouffrère. He is French. Next to him with the long hair is Dr. Ariella Darvish, one of our residents, and Andrea, one of our technicians. They are in this picture, they're taking x-rays of him prior to his surgery. And so we did get an x-ray from Wildcare in San Rafael. However, the digital radiography that we use, we can actually measure the true actual length of the bone so that we know exactly where we can put those pins, especially when it's in a bunch of little pieces, to try to hold things together well enough to put the Humpty Dumpty bone back together again. So this looks like they're taking those x-rays before surgery. If you want to advance. Dr. Darvish listening to his heart. He's anesthetized, and so she's monitoring and making sure that his heart sounds good in between the x-rays that they're taking. Next slide. Go ahead, Linda.
I was going to ask kind of a personal question. So when you're listening to a bird's heart, does it kind of sound the same sort of lub-dub you're expecting from a human or a mammal, or is there something different you listen for?
So Lub dub is because our heart rate is low enough that we can hear the two heart sounds that our heart makes. Birds have the same 4-chambered heart that we do. And if we slow it down, you can hear a lub dub, but their heart rates are so high. And in the falcons, 250 to 350 beats per minute compared to an athlete who might be 60 beats per minute, humans.
I'm always impressed that you can
Count them. So you learn as an avian veterinarian, you figure out how to do it to be accurate. And then we've got some really amazing equipment now that we can attach. And if I'm counting, it taught me that I was counting correctly and accurately. But it isn't easy to do. It's definitely a skill that all of the residents have to get up to speed on. And then here it looks like they are just putting a bandage on the wing. The one thing I would say is that you can see here that he has on his head is to the right, his tail's to the left. And you can see kind of a piece of black with white tape around it. That's what's called a tail guard. And that is to protect him when he's in these smaller enclosures, because he does have to be confined during part of this recovery period to some degree to keep him from breaking his tail feathers. And so we as veterinarians are trying to remember to do that when these animals come in. Billy and Julie are like, well, you got to get that tail guard on right now, because it's all well and good that we repair the bone and get him going. But if his tail breaks off and he has to regrow his tail, then he's going to be in captivity that much longer.
Yeah, when I saw this picture, I was like, oh, he's got a little tail pocket.
It is. That's exactly what it is. It's a little pocket that Billy made that you can slip the tail feathers into. And then he's got some tape around the base of it that's below his cloaca, his vent, where he excretes from, to make sure that he can keep that nice and clean.
All right. And then I think we have some of the...
Yeah, so this is during the surgery. And so with this system that we bought from France, what Dr. Bouffrere is doing here is he's holding with his left hand, if you will, it's the far right side for you is his left hand. He's holding the bone still he's got on surgical gloves, everything's surgically draped, everything's been sterilely prepped. And he is using what we call a pin chuck that actually allows him to be able to drill down into the bone and place that pin. With this system, you have to use the bar and you have to put the pin through the bar. You just got to flip your head as to how you do it as a veterinarian. So that is what's happening here. This is, I think, one of the only intra-op pictures that we had.
So, with these pins, for people who don't know, and I think a lot of people do know, most bird bones are hollow. So how much structure of bone are these pins going into versus kind of going through empty space within the bone?
So when you think about the bones that are hollow, those are the bones that are actually attached to the body. So the long bones of the wing, of the leg, are attached to the body because air sacs from inside the body go down into those bones. Out here, these bones aren't hollow, but they're not huge. So when this bone fractures, we're looking at it just like we would any other bone. But to your point, if it were, say, the humerus, which is your long bone attached here to your shoulder, we also have to be careful then. We can't use fluid to flush, sterile fluid to flush, for example, if we've got blood there, because it can go into an air sac and it can drown the bird. So there are things that we have to think about with a hollow bone. Also, we have to be, we're always careful about infection, but our brains just keep going over that with a hollow bone that could go directly into the lungs and the air sac. We don't want any potential for anything to go in and to occur through that. And so, this picture, I think, was at the end of surgery. And I believe that they were just getting ready to take the postoperative radiographs. And so we go back, take x-rays after we've done the repair. And I do believe you got those as well, right, Sean? That we do have an image. I think we've got a before and after of an x-ray as well from it. Yeah. But you can see there, thanks.
There's the post-op.
So this is obviously the after surgery, the post-operative, and you can see that they're using a pen kind of to see if it's straight. It seems pretty down and dirty, but it works to make sure that you got the pins or you got the pieces as in alignment as possible. And they did an amazing job because it was kind of shattered.
All right, so let's go back a couple steps. I think one too far. There we go. This was the next one. Again, I think checking out
pictures again of showing the Fixator. I don't think there's so you can see the metal bar there, and that metal. If you've ever seen a Fixator on a human being, it's exactly the same thing. It has little screws in the top of it that holds the pins to the bar. And because of that, it's not completely smooth. And that's why we'll put a little bandage around it. I thought there was an image of that, but you can see they've just come out of surgery because they still had on their surgical gloves. And still asleep here. He's got an EKG on. So the little clip that you see there that's got the white on it is one of the clips. In humans now, they just use little stickers and they put the clips on that. We can just put a clip on his skin and we can get an EKG of him and make sure that his heart is staying healthy and happy during the anesthesia.
And I guess, people think about like anesthesia and animals and humans and all this kind of stuff. Like you're obviously not like just shooting a tranquilizer dart at them, but I'm thinking like the times I've gone under, they do all this math to figure out exactly how much medicine I need and all that kind of stuff. Like where does it fall in between tranquilizer dart and tons of math to figure out how much medicine to give them?
Go back to tons of math to figure out how much we're going to give them, because when we do surgery, we want to make sure, number one, that the animal is nice and relaxed. So we're going to need some type of a muscle relaxer to help relax all those muscles, because usually with fractures, we have to pull on the fracture ends to try to get them back in alignment. Often they will kind of override. And then when we get them nice and sedated and their muscles get relaxed, then we can start to pull those bones back into place so that we can secure them with the pins and that they will heal in the right place. So we're going to use sedatives. We're going to use pain medicines. A lot of the same pain medicines that we're going to use in humans, we use in raptors. So I'm not sure what they used in this case, but exactly the same opioid medications that they would use for you for pain during your surgery are the exact same ones that I use when we're working with these birds. And then the inhalant anesthesia also gives some relaxation. It anesthetizes the brain so that the bird is going to be still, totally relaxed, but it doesn't have any analgesia. It doesn't have any pain relief. So we have to give multiple drugs in order to affect all the things that we want to do. So definitely going back to the math, because, for this case, we have to be super careful that we don't overdose little birds. And it's easy to do that. So we calculate and we recalculate to make sure we get it right before we put it into our patient. And then postoperatively, he got some, just like you would when you're still in hospital. Maybe you have morphine, for example. He's got something that's very equivalent to morphine that he was given, because initially, after surgery, it's going to hurt. until things start to finally knit together and the bones start to heal.
And I guess this is an adjacent question we have. So are the pins then removed when the bone is healed, or if they stay in, do they kind of continue to cause some level of pain potentially?
We remove pins, and I can only think of a couple of situations where we've had a pin that went into the bone all the way. These pins, if the bone is here, these pins are vertical to the bone, whereas the pin that I'm talking about would go inside the bone itself. And I've had to cut one of those before and leave it in, which could add a little bit of weight to the bird that we don't want to do. We want them to be exactly the same on both sides. In this case, all of the pins will be removed with the bar. He won't have any appliance left once he's healed.
So we actually just had a somewhat similar case a couple months ago of a barn owl that we suspected had been hit by a car. The barn owl had a fracture in its humerus, so that's the bone between the shoulder and the elbow. Had, just like Equinox, had external hardware, healed up, all got removed, owl got released with no equipment.
Mm-hmm. And that is what we strive for. Like I said, I can only think of one or two instances where I've had a pin that was kind of embedded in the bone that we couldn't get out without potentially fracturing the bone again, that I've made a decision to leave. But all the pins that we use are as lightweight as they absolutely can be for the use for the particular bone that we're using them for. And so the hope is that won't make a difference, but we don't want to take a chance if we can help it.
All right. And another question I think that came up from this picture is there something being used to put over Knox's eyes or protecting Knox's eyes here? What are we seeing?
You're seeing his eyelids. His eyes are closed. So he doesn't have any feathers on his bottom eyelid. So his eyelid comes way up, but that's what you're seeing is his eyelids.
The tape, you might be looking at the tape that's around the
No,
beak.
I don't think so. I think they're talking about right there.
No, yeah, I think the eyelids is what I'm seeing too.
Yep. All right. So a few more of the pictures.
Taking x-rays, it looks like.
Yeah, they're taking the postoperative x-rays.
Do you have to anesthetize him again for subsequent follow-up x-rays, or is there a way you can keep him calm? Okay.
You cannot keep him calm. Now, they may have used a heavy sedation instead of full anesthesia. They did them yesterday, and we were all busy out here, and so I'm not sure whether they used maybe a mask over his face, because again, we're not going to cause anything painful by taking the x-ray. So we could use a little bit of inhalant anesthetic that doesn't have any analgesia to it, because it's only to relax him and to keep him asleep while we can get the job done and get him back up again. I'm not sure whether they did that or gave him sedation.
I can vouch that he was fully awake and in good spirits when
Then
we got back.
they probably just used a little bit of inhalant anesthesia then, because that's going to get them down and up again very, very quickly without any residual. Whereas with sedation, even though we can reverse sedation, they're still maybe mildly sedated afterwards. So based on what Julie said, probably the former.
Yeah, wide awake and ate immediately after he got back.
Oh, good.
So.
Excellent.
I actually have a question on the food front. You have mentioned in some of your other posts and other information that he's been eating rodents. How much of a concern is that for when you have kind of a bird eating raptor? Do they have to eat birds? Are they okay eating rodents? Is any meat fine? What's up with that?
Yeah, so great question. So we are giving him some quail so we can continue to work on feathered carcasses. But the peregrine falcons in the wild, they're predominantly bird hunters, but they will take mammals on occasion. And we actually have a resident non-releasable peregrine falcon here, a female named Phoenix. And Phoenix actually prefers mice over chicks if you give her an option of food between bird prey and rodent prey. She actually picks rodents. So for him, we found that hiding his medication is easiest in a very small mouse.
Yes.
It's kind of like if you get pill pockets for a pet dog, a little mouse works great as a peregrine pill pocket.
That's great.
But for mainstay meals, quail has been a good one for him as well. Nutritionally, he does fine on a mix of both.
And the quail gives him enrichment as well, because he can, sit there and put his feet on each side of it and just rip at it. And so we're hoping that keeps up his bird instincts as well. But getting, the little mouse peregrine pill pocket is often the best way to make sure the meds get into him first. And then we'll give him the rest of his food after he's eaten that one.
And another food question I saw earlier, and I'm sorry I lost where it was, but do you give him gastroliths, pebbles to fill his crop so he can kind of chew his meat, or is he kind of doesn't need that?
So yeah, doesn't need. So a lot of our resident raptors here, they live, these are our non-releasable collection of mostly disabled raptors who are educational ambassadors. They live in aviaries that have pea gravel lining. And even with the pea gravel lining, only occasionally have we actually encountered them ingesting it. Our Harrier does it sometimes. We've had, I think our kites do it occasionally. But a lot of them, even given the option, they don't really need it per se. They will still produce pellets just fine with the roughage that they get from the fur, bones, feathers on their prey. So as he is in a hospital enclosure right now, we are not offering that. But when we do move him outdoors, he will be in an aviary, a smaller aviary with pea gravel. So he will have that option.
But most of the time with raptors, that isn't necessary. In other birds, though, it is. So in pigeons, for example, they have to have they often ingest rocks that go into their gizzard. Just if you think about the gizzard in a chicken, it's the same in a pigeon, but it's not the same in the raptors because they have the fur and the bones and everything that work almost as that crunching mechanism that in a pigeon they would use, say, some gravel to do that, to help to break up the seed, because they'll eat seed whole as they find it, and then they'll leave it to the gizzard to kind of grind everything up. But we just don't need that really in the raptors. And this was just peeking at him. Aren't they adorable when they're asleep? I can say that now because he's asleep. We don't talk about them being adorable when they're awake and, we're trying to get meds into them. But yeah, this was waiting for him to wake up. And so he's in what's called a towel ring. And so we will lay him in that because birds have to be able to move the muscles of their chest in order to be able to breathe. And so think of a bellows for those of us who are old enough to know what a bellows is, I guess, these days. If you think about a bellows, that's literally how they breathe. And so if we just laid him flat down, he wouldn't be able to expand and breathe as well. And being anesthetized, he's not going to breathe as well yet anyway. So we want him up off of his chest so that he can expand it as completely as he can, get as much oxygen in. And by doing that, that's going to help to get rid of that gas anesthesia and get him awake. But I know everybody was, and you can see his eyelids again there, Sean.
Yeah. I really like this question. This goes to maybe broader to the California Raptor Center. Is Knox the smallest raptor you've rehabbed?
Oh, no.
Northern pygmy?
Yeah, we had a pygmy owl.
Yeah, northern pygmy owl that had a fracture.
We get occasional.
Yeah.
So pygmy owls would be the smallest raptor species that you're likely to encounter in California.
They're about an ounce in weight.
About that tall. We don't really get them here often because we're the wrong habitat for them. They're much more of a coniferous, higher elevation species. But every once in a while we get one. I think the last one we had was 2-3 years ago that hit the side of a parking structure.
Yeah.
But yeah, they're the smallest. Biggest ones we get are golden eagles.
That's right.
We do regularly get American kestrels all the time. So
so they are the smallest falcon, and we see quite a few American kestrels every year.
Is there a marked difference in what you are able to heal between the large birds and the smaller birds?
Yeah, years ago I would say yes. I think there's challenges regardless of whether you're big or little. With a really big bird, giving them enough space, for being confined can be really hard to do as well. They're going to be potentially more dangerous if they are not eating and we have to medicate them. That's a lot more challenging to manage that bird in rehabilitation overall than it would be, say, in a small bird. But from repairing, like I said, from different sizes of bones, we have different sizes of pins and different sizes of appliances that we'll use to put on, depending upon the size of the animal. I think it's in the postoperative period of finding the right enclosures, being able to, give them the right foods that they're going to go after so that we don't have to catch them to give them medications. All of those things go into it. And from the very, very little to the very, very large can have lots of challenges.
And I guess because we're in the middle of what we call baby season, when we receive the largest volume of patients every year, which are primarily baby raptors, I think there's a unique challenge in fixing the babies because of the fact that they're still growing.
Yeah, their bones often we say that they're like butter. They are, almost flexible a little bit. And so, but the good news is that they heal very fast because they're in that growth stage. So if we get a little one and we can get those bone ends back into the right alignment, sometimes a light bandage is all that bird would need. It might not need surgery. Surgery might inhibit that bone growing properly. So we have to think about each case and think through all of the potential risks and benefits that could happen.
So yeah, luckily for Knox, even though he's a young falcon, he was
fully
developed. Yeah, the hard ones are when you get a little tiny nestling with a fracture and figuring out how to manage that.
All right, an adjacent question. So how much does Knox weigh now? And then is he on level? Is he at a healthy weight right now, or under over?
I remember five.
Well, he was 620. Yeah. So his intake weight when he first was brought into rehabilitation at Wild Care, I want to say he was around 620 grams, and he's weighing the same now. And so his body condition, you can weigh him and get his mass, and then you can also feel along those muscles. So where he's got that central keel that his flight muscles attached to, you can actually feel how dense and well-rounded those muscles are, and that tells you a bit about his body condition. So from what we can feel, he's in good body condition, and his weight is where he was at intake.
And I'm not sure whether or not Dr. Buffer and Dr. Darvish did weigh the pins and the bar. They're going to have some weight to them, though. And so he's lost some muscle mass. There is no doubt about it, because he's been confined for over 2 weeks. And he's a peregrine, and his metabolism is through the roof compared to ours. So, he's got a ways to go, but we're really, really pleased with where he is right now.
And then, just looking at this picture, it's such a wonderful picture, just kind of seeing him kind of just rehabbing. There was a question earlier, which I missed quite a while ago, that was more about what is his kind of experience with people now? Like, how much do you interact with him? And how is he acting? Is he acting as you'd expect? What's he like?
Yeah, he's acting just how I would expect. We try and interact with him as little as we possibly can. So now it's, we just kind of go in there and throw a little bit of food at him, apart from changing his bandages every once in a while. So we're trying to be as very hands-off as we possibly can.
Yeah, he's basically in our hospital or quarantine building. He's got essentially. Oh, sorry. He's got a private room, essentially. And in that private room, he's in a soft-sided kennel. And he only has one roommate. They're not in the same kennel. There's separate hospital cages. So it's Equinox in his hospital cage, and then there's actually another barn owl that has another external fixator on its wing, and that's it. So he's basically all by himself. It's a nice quiet spot.
And I would say that this picture, you know, because it's such a wonderful picture that he's looking straight on, it's not like we're staring right in his face taking a picture. It's the soft-sided kennel that we have for him has a zipper around it, and Billy would unzip it and put the camera underneath it and take the pictures. So, you know, he couldn't see Billy as he was taking that picture.
Huh. So he just sees this disembodied camera floating into yeah. I think so. We have kind of gotten to the end of what we had said. We're happy to hang out a little bit longer if you guys are able to, but we understand that you guys are incredibly busy. So we might have to kind of call it a day. But I wanted to really thank everyone for your questions and all of your interest. And then just wanted to give a shout out to all the organizations that supported Knox in his recovery and rehab and surgery. The Bay Raptor Rescue for helping rescue. Wild Care in San Rafael for doing amazing work getting him initially assessed. And then, of course, the California Raptor Center at UC Davis for surgery and excellent care. And then for the future, anyone else who will work with him. All these organizations are great places to donate if you have some money to send their way. I know being able to show appreciation for Knox's care is really is a great, donations are a great way to do that. But thank you everyone for attending, and thank you so much to the California Raptor Center for taking your time to talk with all of us.
Sure, you're more than welcome.
Thank you for having us.
Enjoyed it.
All right, thank you very much, and we'll kind of call it there.
All right.
Bye-bye.
Bye.